Hello, everyone. Welcome to Stan&Chelle show. What do you know about holistic medicine? Today, we have our special guest, Dr. Alisma, who will give more detail about the field. Hello, Dr. Alisma. How are you doing today?
Oh, I'm pretty good. Thanks for asking. What about yourself?
I'm doing pretty good. Thank you for
That's
being part
awesome.
of the show. So, for the first question for today, what is holistic medicine?
So, the best way to summarize holistic medicine would be a combination of conventional medicine. Conventional medicine being, what we're all used to whenever we go in to see a doctor for whatever reason. It will be a combination of conventional medicine as well as alternative medicine. So, typically with alternative medicine, it includes like different therapies that are complementary to conventional medicine. So overall, you would say holistic medicine will be a combination of conventional or an integration of conventional and alternative therapies and medicines. The biggest difference would be that with the philosophy behind holistic medicine, the biggest thing is to treat the whole person being mind, body, and spirit.
Awesome. Mind, body, and spirit. That's
Yep, don't forget
awesome.
that spirit.
Oh, yes, that's good. So, why did you decide to become a holistic medicine practitioner?
Okay, so for me, I always knew I wanted to get into medicine. When I went to college, which was at Florida State, by the way, some mental chop. Anywho, back in Florida State, I knew for sure I wanted to go into medicine. Once I graduated, I took some time off to really just kind of reflect, on what route, what path I wanted to go down in terms of like journeying into medicine. But the biggest thing for me was definitely seeing how, my mom had to interact with like doctors with her health and in and out of doctors. And I knew for sure, like even going in on visits with her, speaking with other doctors, just watching how they practice, that I felt like something was missing, in terms of their approach. So while I did more research during the time that I took off from school, I actually came across and discovered holistic medicine, specifically the field that I'm in, which is naturopathic medicine. Read up on their philosophy, got into the way that they practice their approach to like patient doctor relationships or patient client, doctor client relationships, and I was sold.
That's good. You were
Yeah.
so
Yeah.
awesome.
I really, really like the way that they practice the whole approach of the mind, the body, and spirit, like treating the whole person. To me, I'm just like, you cannot go wrong with that.
That's nice. So, you
Yeah,
heard, listeners, you cannot go wrong with that.
you
So,
can't.
if our listener want to become a practitioner, what are the steps that he needs to go? Uh, yeah, what does he need to do?
Okay, so I'll speak specifically on the field of holistic medicine that I was trained in, which is naturopathic medicine. So I received my training in naturopathic medicine, which basically makes me a doctor of naturopathic medicine. So with being a naturopathic doctor, pursuing a degree in naturopathic medicine, there are about, I want to say, 8 accredited or recognized universities or institutions that offer naturopathic medicine programs, legit ones. Let me start by saying that legit naturopathic medicine programs. 2 are in Canada, 6 are in the US. So the institution that I attended was in Chicago, Illinois, which was National University of Health Sciences. So typically, like if you go to college and you happen to, major in, something else like finances, economics, arts, however you want to put it, or even biology, doing the pre-med route, typically to get in the program, you want to make sure to research to see what the requirements are or the prerequisites are in order to get into the program. So saying that to say, if you happen to like get a degree in something else during undergrad and then you happen to decide later on, hey, I want to get into the field of naturopathic medicine, you just research your school, see what the requirements are to get into their programs. And so long as you take those courses and meet their requirements, then you can get into the program. The program itself is about 4 years. It basically mirrors, in a sense, the same path that regular medical doctors take. So the first 2 years are, of course, in lecture, classes. Then the second 2 years are basically you like in the clinical phase, applying everything that you learned in the classroom. if that makes sense. The biggest difference, of course, would be that with naturopathic medicine, we are required to do more hours and additional courses, some of those being botanical medicine, homeopathy, hydrotherapy, clinical nutrition. Like nutrition is a big one that they really drill in the, naturopathic medicine program. So when we say they look at the whole person, when we say we do that like all around. They train you to do that and they train you well.
Can you give like a detailed note on your field, what you do like on a day-to-day basis if you have a client come to see you?
Okay, so basically like a day in the life of a naturopathic medicine doctor. It's gonna differ based on where you're located. So what I mean by where you're located, there's about like 25 states right now that are currently licensed for naturopathic medicine. So when I say licensed for naturopathic medicine, meaning that they have a law or laws and jurisdictions that basically regulates how a naturopathic medicine doctor would be able to practice in those states. So they recognize them as doctors or physicians, however, they choose to identify them. And they basically have guidelines on how they can and cannot practice and what their scope of practice would be. So if you are in an unlicensed state, because of course there are states that are still unlicensed, then essentially you are technically not allowed to refer to yourself as a naturopathic medicine doctor. So the way you would work would be a little different because you're not allowed to treat any disorder, condition, or whatever it is. You're not allowed to treat anything, and you're definitely not allowed to diagnose. So when working in an unlicensed state, you're basically, equipped to give consultations, if that makes sense. So in essence, but all of the knowledge remains the same. You just have to be mindful of how you are approaching your situation in terms of when you're meeting with a client or if you're meeting with a patient. So for example, in a licensed state, being that you're recognized as a doctor or a physician, and there's a scope of practice where you have laws that tell you, hey, here's how you can and cannot practice, then you can refer to the people coming to see you as patients. If you're in an unlicensed state and people are coming in to see you, you would have to refer to them, as clients, if that makes sense. So the approach though would still be the same, whether you're giving a consultation or if you're treating them because you're in a licensed state, you still take the whole person into consideration. So a lot of times you'll have people coming in, and when they come in to see you, they're basically like at their wits' end in terms of having gone through, the ringer, just the whole belt line of, seeing doctors back to back on who knows a variety of different medications, but still feeling like they're either not improving or it's just like they feel the same way they felt from the beginning. Just like overall, like not satisfied, with the care that they've been receiving or whatever they've been receiving, if that makes sense. So, of course, when they come in, you take a lot of things into consideration. You don't just see the person for what brought them in to you, if that makes sense. You know what I mean? So if someone comes in and tells you, hey, I'm having trouble sleeping is what brought them in. But when you're investigating, you kind of go into, well, hey, what's a typical day like for you? How's hydration? What are you eating? Who are you around? How's your stress level? All these different things you have to kind of investigate to figure out what's the underlying thing that's basically allowing the cycle of not being able to sleep to continue, if that makes sense.
Makes sense. So as you can see, if you're interested, you're gonna be able to do all of this that Dr. So that's good. And my next question, what can they do within the field of holistic medicine?
Okay, so in the branch of holistic medicine, I mean, there's a variety of different directions you can go. So just once again, I'll speak on what I was trained in, which is naturopathic medicine. So as I mentioned, if you're in a licensed state, then you can continue on, pursue your career as being a naturopathic doctor or a naturopathic physician in that licensed state. If you're in an unlicensed state, of course, you have to get more creative. So you would be considered, like a natural health consultant, because you technically cannot say you are a naturopathic doctor, because if there is no jurisdiction or laws for that state and it's unlicensed and you're not recognized yet as a doctor, then you of course have to get creative in terms of what you do, how you do it, and when you're seeing your clients. So yeah, you can give consultations. You can definitely go into working. There are a lot of functional labs out there. So with functional labs, they tend to dig a little deeper than the standard, labs that we all typically get whenever we go in to see a doctor. And then it's like they'll do your labs and tell you everything's normal, but you're like, no, it's not because I don't feel normal. So you have functional labs that'll dig a little deeper to kind of help, identify what it is that's off that, has someone feeling like everything's not where it should be. So with those functional labs, a lot of times some of the naturopathic doctors go on to work for them as like, one of the doctors on staff that helps to interpret labs. Because a lot of times when labs are ordered through them and those results are sent to either the patient, the client, or the office, they can be real confusing. So some naturopathic doctors go into that line of work. You also have, because we get such like extensive training in like botanical medicine and supplements and nutrition, a lot of like naturopathic doctors can go on to also work for like supplement companies to help them come up with like new supplements and what to put in them. Some of them work to help to like sell ideas, kind of similar to like what pharmaceutical reps do, but it's more on like the, I guess you would say, integrative medicine or alternative medicine side. You can do that as well. Of course, there's teaching. There's always teaching. You can work as a clinician with the naturopathic programs. A lot of them include, like a mandatory internship that has to be completed. So you have clinicians that oversee the interns that work in the clinic. But it's endless. Like what you can do with it.
Like she said, like Dr. Alisma said, there's a lot you can do.
Yeah. If you're creative, it's definitely like the world is your oyster. If you're super duper creative.
Awesome. Be creative. That's one good word. Wow, those are a lot of good information. And I have another question for you.
Yes, of course.
If an holistic doctor decides to become an allopathic doctor, will he or she has to go back to medical school?
Okay, so they would have to go back to medical school. Definitely because when you're working towards getting the license, you still have to meet the requirements for that license, if that makes sense. So some of the courses that we take cross over. So that's why, one, it's super important to attend a naturopathic medicine school that is accredited and recognized. You'll have some people out there who do like a diploma program that's like 6 months, or they'll attend a school that's not accredited, which makes it more difficult if they want to, attend a school like the allopathic medical school. And then they'll run into difficulties having their credits transferred. Of course, it's up to the school. They have the final say, whatever school you're trying to go to, whether they will allow some of those credits to transfer or not. But at least it gives you a head start, if that makes sense. So you would have to go back to school because you would still need to meet whatever the requirements are in order for you to be able to sit down to take the exams for licensing. So if you want to flip that question, I know for sure, like when I was doing my program, there were a couple of students who had already gone to allopathic medical school to be MDs, but they still had to attend our school for naturopathic medicine. Now, what I will say, they were able to skip through a lot of the courses, being that they already took most of those courses while they were in the conventional or, allopathic medical school. So they were able to skip through, a lot of the courses, but for the ones that they still needed to meet the requirements of both the university and for being able to sit down to write, the tests for licensing, they still had to take those courses in order to be able to do the exam, if that makes sense.
All right. I have another question for you. What one of the biggest error that most people assume when they deal with holistic medicine practitioner?
So there are like a lot of common errors. One of the biggest that I commonly tend to see, and I know my colleagues tend to see it as well. A lot of times when people will come in, to see a holistic medicine practitioner, and again, like I said, I'll speak on the field that I was trained in. To see like naturopathic medicine doctors, or even if they come in for like just a like a natural health consultation, because again, it depends on where you are and where you're working. A lot of times they will come in and have the assumption that you are not as knowledgeable as if they were to go in and see like a conventional, medical doctor a lot of times. So they'll undermine how knowledgeable you are. It's basically what I'm saying. And a lot of times that comes down to just not having the common understanding of what a lot of the naturopathic medicine doctors or just holistic medicine practitioners, for example, like chiropractors, acupuncture, like not having a good understanding of how much training they have to go through in their educational background, if that makes sense. So it's like the amount of information we're required to know at times may be just as much, if not even more, than what your, regular conventional medical doctor has to know as well. So it's just, of course, the fashion in which we're taught that information may be a little different. Of course, for like, the concrete subjects like the anatomies, the pharmacologies, and, things of that nature, of course, that's like concrete is taught how it's taught. But, when you kind of go into the alternative therapies, that's kind of where, the limitations are for some of the conventional medical doctors and where holistic medicine tends to shine, if that makes sense. So, of course, the way we're taught to understand the body and the person is, of course, different than, how conventional, medical doctors are taught that information. So again, that's why, I like to reiterate the whole person approach. So just to get a better understanding of the whole person approach, for example, if you go in and you say to your doctor, I'm here because I've been having a bad stomach ache, for the week, your doctor may do testing. Testing comes back and it's like, okay, I don't see anything on here. You're fine. Go home. And the person's like persistent, like, no, I have a stomach ache. I still have it. I've had it all week. Something else needs to be done. Then at that point, the doctor may say, hey, I'm going to go ahead and refer you to this GI specialist, gastroenterologist, to take a further look. Whereas if you go in, you see like a holistic medicine practitioner, naturopathic medicine practitioner, or whatever have you, they have more of a tendency to say, okay, the person came in with a stomach ache, but they won't look at the stomach ache or the stomach itself, like by itself as one separate part, but they'll take a look and see, okay, well, how's your diet been lately? Are you eating something that's aggravating your system? Are you eating something that your body doesn't tolerate? Or have you been stressed out this whole week, which will definitely affect your digestion, the environment of your gut. So they take all that into consideration. So they won't look at the problem as just the problem itself, like, oh, where did you come from? That is, the problem is just in this one part. So that's the only part we focus on. But they look at all of the running parts and basically which one is kind of like thrown off. That's contributing to the problem that has the part, if that makes sense.
That makes sense.
So yeah, I would say that would probably be the biggest error in assumption. Because a lot of times when people think, holistic, they'll think like, okay, I'm just going to start drinking green juice and, maybe go outside and hug a tree, and take a deep breath of fresh air, and then meditate. And I'm good. I got my holistic medicine, but it's definitely more than that. Don't get me wrong. If you do those things, you continue to do them because they're all great, for the spirit and for the overall body, but it definitely takes a little bit more than that.
Okay. All right. So guys, don't assume. Make sure you check Dr. Alisma, and she's gonna become my personal doctor too.
Depending on what state you're in. Depending on the state, I'm technically not allowed, to say if I'm in a licensed state, for sure. If I'm not in a licensed state, I cannot throw out the term doctor. Oh, which also brings me to touch on another point with licensure. So this is something to consider as well. And this is also information that you'll find in the links provided, the reference links. A lot of times if you're like a student and you graduate, you become a naturopathic medicine doctor and you go off to a state where you're licensed, of course, you continue on, do your pattern of studying, taking your board exams, because naturopathic medicine doctors do also have to take a board exam. The link will be included for that. So you get an idea of what that is as well. And then they go on to get their license, for the state they're practicing in. On the other side of that, when you have students that decide, or know already, hey, I'm not going to be working in a licensed state, I'll probably just, do, like lifestyle consultations or natural health consultations, or whatever have you, they want to be an author, whatever the case may be. A lot of them will still go on to take their exams to make sure that they are licensed in one of the states that are licensed. So what I mean by that is, for example, let's say if you're in Alabama and you provide natural health consultations or you work with clients in Alabama, that person in Alabama can still study to take, like, for example, one of the licensed states is Washington. That person can get out of school. While they're in school, of course, they would look and take a look and see if they know, hey, I'm going to get a license with the state of Washington. Look and see what the requirements are for the license, because there are elective portions that you can add on to your exams that some states require. So you take a look at that, make sure you take all of the testing that's required to get the license with Washington. And while you're in Alabama, even though you can't use your license in Washington through Alabama, you still have your license with Washington, because it's like another way of showing like your competency, if that makes sense. Like you graduated, went through the program, and you were competent enough to get your license. It's just that the state you're in is not licensed yet. But it's always a good idea to have that, because that's another way to kind of help set yourself aside from other people who do like a quick 6-month program and say, oh yeah, I'm a naturopathic doctor too. It's not. It's like, we are not the same.
Okay. So how much is the cost for the license? Do you have to pay for the license?
You do. And it's based on the state.
Okay.
So the cost of a license varies with the with the different states that are licensed. So with the states that are not licensed, many of them do have like a naturopathic physician association that is typically working towards getting those states licensed. I know many naturopathic doctors like myself and many others have their fingers crossed for different states that they want to get licensed in the near future. But that's also a reason too why it's like important to keep a license even if you're in an unlicensed state, because then once that state becomes licensed, you won't have to go back. Because let's say you graduate and you go to a state that's unlicensed and you've been there for 6 years, and now on year number 8, the state decides to become licensed. If you don't have a license that you can transfer to that state or show competency that you passed the exams already, now you're basically put in a position to have to go back and study all that information to now take the exam and then get the license. You know what I mean?
Yes.
Instead of when the information's fresh, so it's like you go ahead and do it.
Okay. All right. Thank you. All of these are good information.
Yeah. Yeah.
So what is the salary range for a practitioner?
So it's difficult to say like what a salary range is overall. A salary range would be more based on where you are. So again, that ties back into if you are like in a licensed state versus an unlicensed state, if that makes sense. A lot of times with some naturopathic doctors, when they'll go into unlicensed states, they'll have a tendency to go ahead and open up and start their own practice. So what your salary will be is kind of like up in the air. It's based on, how well your practice basically takes to the community where you are and takes off, if that makes sense. So it's really based on what area you're in. Also, too, you have some students that'll graduate and then they'll roll over into a residency, if that makes sense. And of course, the salary for a residency is going to be a little different than what the salary would be if you just get out there and practice, in the real world. So I say that to say it varies. It's really just based on what area you're going into or what state you're going to.
Okay. So all depend on the state that you go, guys.
Yep, the state, and also if you roll into a residency.
Okay. So if the salary is depend on for the salary for the job market is the same thing, or the job market is the job market for the practice?
Again, it's going to depend on where you are.
Yeah.
So the reason why I say that is because like in states where it's licensed and people are familiar with naturopathic doctors and what naturopathic medicine is, and they're like into the, whole theme and the whole realm of holistic medicine, then yeah, you can jump right into that pool, and just kind of figure out your way and then, take off from there. If you are in a state that's unlicensed, then it'll kind of be an area where it's like just the buzz of holistic medicine is kind of still generating like traction, and it's still trying to pick up a bit. So it may be a bit more challenging, is the best word I would say, in terms of kind of finding your way there. But of course, if you are driven and you're a persistent individual, then that wouldn't limit you. It would just require more work, but it can still be done.
It can still be done.
Yeah.
So our last question for the day. For somebody or for our listeners who are considering becoming a holistic medicine practitioner, what advice can you give them?
So the first advice I would say, if you do not plan on being a student for life, then you probably don't want to jump into holistic medicine.
Mm.
And the reason why I say that is because when we say treat the whole person, it really is treating the whole person. So a lot of times it's like you'll have a lot of people come into you and no two cases are alike. So what I mean is you can have two people come see you and say, my blood pressure's been through the roof lately. And what may be the root cause or the reason for person number one will not be the root cause or reason for person number two. So for sure, if you don't plan on being like a lifelong student, because people who come to see you will definitely teach you a lot. Although you'll learn a lot in school through the curriculum, through the program, when you get out into the real world, people that actually come to see you will definitely teach you a lot along the way as well. And you for sure have to stay up on information, because of course people will come in, and try and test you against, Dr. Google, because they'll have all the questions in the world, because Google has so much information. So it's like, if you're not, open to constantly staying on top of things, you're not open to like having to learn basically for like and forever and ever and ever that you plan on journeying into the holistic medicine field, then I would say don't even bother, like don't waste your time. Do not waste your time.
Okay.
Another piece of advice I would say is, before going into it, to be sure you take time to reflect on whether it's really something that you want to do. And the reason why I say that is because like a lot of holistic medicine practitioners will tell you, or holistic medicine, um, or definitely with the field of naturopathic medicine, when you do those 4 years in school, I remember going into it and being told the same person you are when you go in is not the same person you're going to be when you come out. It will try you, it will test you, I mean, it will push you to your limits. So if it's not something that you are for sure that you want to do, then I would say probably not pursue it at the time, or take your time to figure out, why is it that I don't want to do it? Or, why is it that I really do want to do it? Because when you're up, like final exam week, running on 2 hours of sleep every single day for about 7 days until you get through that week, nobody is going to do that for you. Everybody can tell you, hey, go into this, do that, this, but when you're in it, you're the one who has to do it. Nobody's going to call you and say, hey, let me stay up for you and run on 2 hours of sleep for you every day for the next 5 days because I told you to do that. So you make sure it's something you want to do, because for sure it will try every bit of your patience.
All right. You heard the lady, you heard the doctor. So make sure that you really want to do it and sacrifice your time so you can become the doctor that she is right now. And
Yes.
if you have more questions, you can leave it at the comment section below. We'll be willing to give you the answer. And there'll be some website that we're going to provide you. And
Yes.
you can go to those websites and to get more information.
Yes, a lot
So,
of the websites that you'll be providing were a lot of the websites that I researched information from when I first kind of found out about holistic medicine, and then specifically naturopathic medicine. I researched like a lot of those websites to get information, figure out how much time it was going to take me in school, because we're not getting any younger. But I was willing to sacrifice that time. If there was one thing I knew, I was willing to sacrifice that time. But yeah, the websites are super duper helpful. It will give you a lot of information, especially if you're like on the field as a prospect. You're just kind of trying to get an idea of like, okay, well, what does it take? What will it require of me? Get an idea of like what I'm going to have to sacrifice kind of deal. But it gives a lot of good information.
Awesome. So thank you again. Thank you, Dr. Alisma, for taking your time to answer those questions. So I learned a lot, and hopefully the listener learn a lot too. And hopefully it's not gonna be the last time that we're gonna hear from you. And hopefully the next time you'll be back to give us more information and more detail.
Oh,
So
yes,
everybody,
absolutely.
have a blessed day. Thank you again, Miss Alisma, Dr. Alisma, and God bless you all. Bye.
Okay, hope you guys enjoy the information.